Hi, this is Dr. Bird again. Today I would like to discuss three stages of the degeneration of the vertebral bodies. I kind of getting off the topic of all the vertebral levels, but I'm going to continue starting next week. But this is just something that come up with one of the patients that just came in, and this person has really severe back pain, and after reviewing the x-rays, which I'm going to show you later, and this is not his x-rays, I'm not going to show it due to the privacy, but I'm going to show you an example from the Yokum x-ray radiology book, kind of similar what's going on. But in any case, this is the example. As you can see, this is normal, first stage, second stage, and third stage. I'm going to show you up close. This is probably not going to be a short video. It's going to be longer than 10 minutes, so maybe I'll post it on a regular YouTube channel. So this is what the normal vertebral body with the disc looks like. Inside is the nucleus, and this is the disc. And when the vertebra is perfectly aligned, what happens is that the disc stays in the center. Once the vertebra is subluxated, becomes out of alignment, kind of like this, probably exaggerating a little bit. The process of imbibition, basically, this is the way the liquid gets inside the disc. Stop being the water. The process is imbibition is being terminated or reduced, and the disc gets its water by pumping. So when the two vertebrae move against each other, when they're properly aligned, it sucks the water in. When the vertebra is misaligned severely, or just not just slightly, this process, like I said previously, is being terminated. And as a result, obviously it doesn't happen in a day or two, even a month, maybe a course of several years. You start this process at stage 1. See, the disc height is being reduced if you compare it to the first one, and as a result the vertebra, this disc is being disc is being degenerated, and the vertebra, the process of imbibition is like completely being eliminated here. And you can see that the nucleus pulposus is being bulged out already. So after the prolonged period of time, this nucleus is going to leak out either to the left or to the right, depending on how the vertebra is misaligned. And so now this is a third stage where the nucleus is being leaked out. If you can see it here, it comes out from here, and it starts pushing pressure on this nerve. Depending on the vertebral level, neck, mid-back, or low back, this nerve could supply heart, lungs, your stomach, liver, kidney. If this nerve is completely impinged, not only are you going to have a severe pain, but you also have dysfunction of the particular organ that this particular nerve innervates. So conventional medicine will either do the surgery or give you the pills, which will not really solve anything. And as you can see, it comparing to stage 1, it creates these rigid, like sharp edges. They are called in this medical term osteophytes. What it does, the vertebra basically grows in, and it prevents from collapsing against each other, in order to preserve the life of the nerve. Because if this nerve is completely cut off, the person can basically die, or that organ will stop working completely. I'm going to show you a little bit here the image of what it looks like on Yokum X-ray book. This patient that came in, you can see it here, and you can see it here, and so, this is very painful process. You can also see this very well on X-rays. On MRI, it will show pretty good the osteophytes and how the disc will go into the spinal cord or peripheral nerve impingement. You can see it very well. I don't have that image here. And the final stage is basically what we have here is the vertebrae fuse. You don't have any movement. If you can see, the disc here is bulging and pushing pressure on the nerve. Here it's completely gone. So a lot of times what other surgeons will do, basically they will offer some sort of a surgical procedure. But at this point it's too late. And if the person got to this stage, the recovery period is going to be like taking forever. You can see the disc is almost gone. And so what happens is here the vertebra basically fusing, which is a lot of which happens in most of the cases when it gets to like severe stages of this degeneration. You can see it right there. And what it does is when the vertebral computer fuses, comparing to this one, when there is still some sort of a space, basically it preserves the life of this nerve. But this particular person is not gonna have a good quality of life. This is just gonna be a miserable amount of pain and discomfort. So what we can do here, I mean, we cannot fix this. We cannot fix this. We can make you a little bit more comfortable with this, but this is what went way too far. What we can do is that help you to align this particular vertebra that started where the disc start degrading, and to bring it back to this particular shape where it was healthy. Assuming you didn't, you have a normal activities of daily living, you don't drink, you don't smoke, and hopefully exercising from time to time. And basically when we work on this, we will help you to go into this. But if you come with us with this particular problem, what we can do at the office is make you a little bit more comfortable, and so you don't get to this stage. But we can't reverse this process. This is mission impossible. So if you know anybody who has problems, send this video to your friends or family, and let them know about us. And if you have any questions, feel free to contact us. Have a good day.